at 5.
Okay, thank you.
But if you sign, it's the same link though. I think if you can
Yeah,
sign in on the same.
Okay, thank you. I don't think that was me. Hi, Charlie.
Hey everybody, how you doing?
Good.
Good.
Good afternoon, Angela. Okay, Joe, it's 4:30. Would you like to start with the COVID
Sure.
presentation?
Sure. It's Joe Nicholson, City Manager. I know we're on a short leash with this, the COVID presentation today, so I'll add what I can add. If we have to cut it short, that's fine. I don't have a lot of information to provide to you today, but I will observe that the numbers with the week ending 4/10 last week, we're up to 87 new cases. You can contrast that with the numbers that were reported for the week before, the week ending April 3rd at 82 cases. So our cases are slightly up. That's the 6th highest weekly case count we've had here in Newport since the pandemic began, or at least since they RIDO started reporting the numbers, which was as of the week ending 3/7/20. So a little over a year. You know, however, and I don't think it's anything to be alarmed about, and I think if you listen to the press conference today, there's a clear explanation from state officers as to what's going on here in Rhode Island. But, you know, my own observations that the cases statewide seem to be in the lower age group. My observations indicate that the highest concentration is in those that are 19 to 24 and then 30 to 39. And then as you slide up the scale, and this, I think this makes perfect sense, or at least I can make some logic out of it, is as you slide up the scale, the cases start to dramatically drop, which I think is most likely, and it was confirmed by, I think was alluded to by Dr. Scott in her presser today, that yes, younger ages, household transmissions, but there's a decrease in hospitalizations as well as death, which is a product of vaccinations. Starting Monday, eligibility will be for those that are 16 and over. And I think it was announced today that tomorrow there will be 16,000, yes, tomorrow evening, 16,000 vaccinations being become available on the state portals. You know, some of the good news today that came out of the press conference that you should all be aware of is that Governor McKee announced that RIPTA will be providing free rides to vaccination sites. And anyone that's interested in those, that free ride, as it were, can call 401-781-9400. That's 401-781-9400 for information about the free RIPTA bus rides to the mass vaccination clinics. I indicated to you that, of course, Monday it opens up to 16 or over. People can register can register to be notified about available vaccination appointments through the vaccine interest notification list, which is https://portal.ri.gov/. So if you go on the RIDA website, you'll be able to pick up those that information, which of course, as I've been telling you, it's probably the best place to glean information, as well as to listen to the press conferences that the governor has each week. I found them to be very informative. He has his whole team participate in those press conferences. I mean, you're all aware of the Johnson & Johnson vaccine pause. At least what I gleaned from the press conference today, it's not going to have any great dramatic effect on the vaccine rollout in Rhode Island, but it all remains to be seen. And of course, the supply issues supply seems to be ramping up fairly well. I know a number of you have had questions about, in this process, things change pretty dramatically, or the information changes overnight. At least locally, it certainly does. I thought last evening when I went home after the council meeting, I actually received a text from Brian Doong, and I thought we were going to get our hands on locally a number of vaccines. That turned out not to be the case. We are working with the Chamber of Commerce. We have been in contact with the governor's office about restaurant workers. The Chamber of Commerce has sent out a survey trying to glean the interest from the restaurant industry locally, or they will be sending out a survey that will glean the interest from the restaurant workers as to vaccinations. That's a good thing. I've had conversations through text messages, not only with Elizabeth about this, but also with Councilor Holder as late as this morning, I think a few hours ago. And and the governor incidentally mentioned it in his press conference that yesterday he met with people in the industry, and they're attempting to come up with a program for restaurant workers. I am working with a group that's entitled the Newport County Community Health Collaboration, which some of you may be familiar with, most of the local social service agencies, and attempting to identify those communities that probably need the most help with vaccinations. And it's a media campaign for the most part. It has 3 components, which is awareness and education, outreach, and barrier reduction. And so that group is working kind of on the media stuff, and all elements within that group all have been working on the actual vaccination efforts, as you're all aware, as we have. So I think some things are going to be happening in the next, I thought they were happening last night, quite frankly. But so we'll see. At least there's a lot of conversation going on, and issues like restaurant workers and the difficult to reach communities, those are really getting a lot of, I would say, a lot of discussion, a lot of concentration of late. So that's about all I have today, and I'm more than happy to entertain any questions that the council may have, considering the short time frame that we have to deal with this today. Actually, 7 minutes isn't bad, so we got plenty of time. Any questions?
Yes, Joe.
Joe.
In terms of the restaurants, is there further discussion about mobile units going to the restaurants?
Yeah, I'm not so sure, Gene. I was thinking about that today. I'd love to see. I got a call yesterday, and it was from a group that is employed by the state outside contractor, and she used the phrase mobile units. I thought that's what she was talking about, mobile units for vaccination. She was talking about mobile units for testing.
Okay.
I don't necessarily think that the mobile unit issue is going to appear. What I think is going to appear, ultimately, this is my gut reaction, is that We will have to stage at some site somewhere, whether it be one of our local schools or one of our local facilities. But I think it's going to happen, and that's been the plan anyways. The general plan anyways is at some time you have to crash back into the communities. And right now, obviously everything's concentrated on the mass vaccination sites, and indeed this free transportation offer by Ripter, I think is pretty neat and is going to help quite a bit. But ultimately, it has to get much more provincial. And the governor's mentioned that a number of times, crashing back into the communities. And at least you can see the conversations happening, trending towards that end.
Okay. All right, Councilor Holt. You're muted.
Charlie.
Okay. Charlie, you're muted.
There we go. So I've been reaching out to restaurants just to kind of gauge an interest as far as how many employees that are looking to get vaccinated. And from the handful I've gotten feedback from so far, we're looking at anywhere between 15 and 20 employees per restaurant. And that, like I said, that's only been a handful so far. I know they've been busy this week with the restaurant week going on, and everyone's shorthanded and whatnot. So I think there's going to be anywhere from 400, 500, 600 people that might be eligible to get vaccinated. And our concern is with the not just restaurant industry, but just business industry alone, to get business back to a normal routine, what we're used to. We have to get to like 75% vaccinations. And the fear is we're not going to be able to get to that number. Just either people are afraid to get vaccinated, or they're anti-vaxxers, or they're not at the age group that can get vaccinated. So I would like to try to, I'm trying to do my best with the people that I deal with to try to get as many people, encouraged to go get these shots. And I'm just hoping that everyone else can do the same as well. But my concern again is, if we can't get to that number, we're not going to be able to increase our capacities and whatnot. So,
yeah, I think, Charlie, my observations is that it is not slowly, but it's becoming a priority with the state. Otherwise, I don't think the governor would have mentioned it at the press conference today. I saw that as a positive trend. And of course, you're familiar with the efforts that the Chamber of Commerce is making with the governor's office as well as discussions that I've had with the governor's office emphasizing that need. And also this group that I'm working with, the Newport County Community Health Collaboration, recognizes that need as well from a press standpoint. When you mention things, people that are, might be concerned about the vaccination, getting vaccinated, these media blitzes at least help to temper that in some way. And I agree with you. We're ready to go. It's just a matter of the supply being allocated. And as I said, I sent you that text late last night. That's the impression we had, that we were going to get our hands on overnight a lot of vaccines. And again, to stand up and getting back to Gene's question about a mobile unit. Most of you, if not all of you, got vaccinated out at, if you haven't, most of you at CCRI. So you were witness to the heavy lift that has to occur to not only monitor and introduce people into the site, but the actual vaccination and the after monitoring as well. So it's not to organize a pod. It's not an easy thing, but we were able to pull it off. And then, of course, if any of you have been up to the mass vaccination sites, I understand they're well. They have quite a few personnel. I took a tour of the one in the Benny's one, and there's a lot of people that you have to mobilize to get these things moving. But we're in a position to do it. We've done it successfully locally. It's just getting our hands on the doses and the target, and we're ready to go. No matter what, we're ready to roll.
Okay.
Well, it's strange that I know with the hospitality and the Department of Health, they want to send out a survey to people to gauge an interest. It's like, I'm pretty sure everyone's really interested in getting vaccinated one way or the other. It's like, let's skip that step. It's like, it just seems like there's more red tape involved than just getting out there and like, this sounds, it's going to sound stupid, but at some point it should be like an ice cream truck going up and down the streets of a neighborhood, ringing the bell saying, hey, who wants a vaccination? We can get it done.
You and I are on the same page in terms of the approach. I agree. I'd like to see this thing, I'd like to see it quickened because the demand is there. You know the demand better than anyone since you're in the industry. And so, the method, at least from my perspective, could be quickened.
Absolutely.
Yes. Any other questions, Councilor Holder?
Oh, no, I'm good.
Councilor Underwood, Segley.
Hi, Joe, could you tell us what the requirements are on presenting IDs for vaccines? And is that a hindrance to some groups? I heard that you don't need to have an ID, but then I heard that some people were stopped because they didn't have IDs. So I was just curious.
Well, I think you've asked that question before, and I told you I get the answer. I don't know the answer.
Oh, I don't remember asking.
Yeah, sorry about that. So, there are people that don't have the appropriate, I guess I'll say appropriate identification. So, I've heard the same thing. You don't need it, but then again, it's somewhat counterintuitive that if I show up and I say I'm Lynn Sigley, okay, go ahead, progress in the line, and I'm not Lynn Sigley. So how do they make that different? And then you come in 3 minutes later, said I'm 3 minutes late. How do they make that differentiation? I don't know, Lynn. I think that's why they try to push this, at least the sign up process so aggressively in the pre-registration. I'll dig out some information on that. I have the same information you have that you don't need it, because there are people, we know there are people that maybe undocumented people that don't have mainstream identification, and they deserve a vaccination just as much as the next person. So I'll dig that information out for you. It's been a discussion a number of times.
Okay.
I just want to say that I was going to come to your aid, Angela, but Jean's already got it.
Yes. Councilor McCallum.
Okay, so I think to your point too, I was kind of curious, like I'm glad to hear about the hospitality industry and that we're, trying to get to those who are probably like frontline workers of some sort. And also, I mean, there's been a lot of traction in Providence regarding BIPOC, the BIPOC community and the vaccinations. And I wonder if we are seeing the same need here as well.
Well, I don't have my finger on need. The state has their finger on need, and indeed, the communication that Rido had with our fire chief yesterday was about that community and about allocating we'll call it X number of vaccines to that community. So that's why I started floating around a text. I sent one to Councilor Holder because we also immersed in that outreach restaurant workers, and I haven't looped back with Brian Dugan yet, but the last communication I had with him today was, well, that's not going to happen right now. So we'll just have, as I say, the information changes quite a bit in a 24-hour period. And this wasn't even 24 hours. I think I communicated this with Council Holder and Brian Dugan at 10 o'clock last night, and then 9:30 this morning, things had kind of dried up a little bit. But we are working with those communities, and we'll just have to see. Again, it's the issue of supply and the allocation. It's not an issue of the infrastructure. We've got the infrastructure, and the infrastructure is there to get it all done. Not only if we have to reinsert the infrastructure, because we're not operating CCRI any longer, but also I think this issue of the RIPTA, hopefully this RIPTA transportation issue will help out. I got to imagine when people get in the groove on it, I think it will.
Councilor McCallum?
Yes, okay, so the reality is we're not really seeing anything in terms of the BIPOC community, but it's...
I'm seeing a lot of talk. I'm not seeing any vaccine. So that's what I'm referring to, what I saw last night. I'm not, no hard allocation. In other words, we will deliver to you next Thursday, 1,000 doses of something. That just hasn't occurred yet. But the conversation is there. Those discussions are happening. I think, and one of my frustrations, quite frankly, is the discussions happen on a lot of fronts. And I like to think that I have my finger on all the information, but I don't. I find out bits and pieces from this group is organizing a clinic. And I said, well, what do you mean they're organizing a clinic? Or that group's organizing a clinic, and so on. So I try to make the rounds to these various groups and places, and I think one of them is this Newport County Community Health Collaboration. The next phone call that I have with them, I think I had one early next week. Some of this will be better defined as to where is everyone on this, because it's all the groups that we all are familiar with in terms of the local social service agencies as well as providers. It includes Newport Hospital, includes EBCAP, includes you name it, they're on it.
So there are community stakeholders, what I understand, if I'm understanding you correctly, that are
correct.
On this. Okay.
That's correct. Yeah, that's right.
And I also do want to bring up that we should still be talking about the concept of showing IDs. I know that you had touched upon it, but I am getting confirmation from other residents and other places that are actually validating that our sites are still showing, like asking people to show their IDs. And we really need to be ahead of this and making sure that there's some compliance there.
Well, I want to correct one thing you said. We don't have a site any longer. These are the mass vaccination sites that are operated by the state of Rhode Island. So I will try to get the information. I just don't know the answer to the question. I had heard the same thing that Lynn was, that identifications should not be an issue. But I will chase that down.
Okay. And then just last thing, although, Joe, I can certainly understand information being shared with Counselor Holder. I also want to express the fact that all of us represent also workers in the hospitality industry as well.
Let me just say this was, and I'll just say to you in my own defense, this was 10 o'clock at night, and Counselor Holder reached out to me, I think earlier in the day about it. So I just forwarded him a text. So I'll be sure to, let me see how many, there's 6 or 7 of you. I'll be sure to include all of you in my text messages, but it was to get it off my desk because I know he's been working with Aaron Donovan at the Chamber of Commerce as well. But I'll send it all out to you.
Okay, Counselor Forte.
Thank you, Madam Chair. We're also seeing an increase of a lot of our BIPOC community, just to piggyback on what Angela was talking about locally here in Newport. We also have the Community Baptist Church that had about 40 interested folks that wanted to go to Providence and get these vaccines, but looking at transportation wise. Even the one from last weekend, trying to get into Woonsocket, it's tough. And we have community stakeholders that are trying to provide transportation for our folks to go and get the shot, but it's limited when you're talking about distancing within a vehicle or even in a bus. There's not that many. There's about 40 alone, and coming from the community Baptists that are interested in getting the vaccine. I just think if we can provide soon an opportunity for our citizens here to get the vaccine, that, especially those that work in the industry of hospitality, definitely it would be a blessing.
If I understand it correct, it's not so much, well, I understand what you're saying as far as the transportation goes, but we're just not getting the vaccines here in Newport. And I'm not sure, I guess the appointments are made on availability. So, that there is a lot of logistics involved.
Yeah, I mean, the closest, I know you're all aware, the closest mass vaccination site is Benny's, which is, literally right around the corner from CCRI. Now with the, Monday, this free RIPTA ride is going to be effectuated, and hopefully that's going to help. If it doesn't help, you got to go to Plan B. And as I said, Plan C is, at least from my observations, is for the vaccine program to get back to be localized. When we had our CCRI clinic, what did we have? 648 total vaccines to give out. We could have done. We had the capabilities to do twice that many. Yeah, I agree with all of you. It'd be nice if we could re-immerse ourselves whatever community it is targeted, re-immerse ourselves back into the vaccine business. I think that's the way the program was designed, quite frankly, in the first place, to do that. But I realize that, the state has analyzed it, I think 20 different ways, and the program is the program right now. But we'll keep advocating for the two groups that we've discussed.
Okay, we're approaching 5 o'clock. There's two counselors, Counselor Holder and Counselor Bova. Counselor Holder, first, do you have a question?
Not a question. I just want to reiterate. I know my circle has to do with hospitality and restaurant industry workers, but obviously as a city council member, I'm a part of everyone in the city, and my goal is to get as many people vaccinated as possible. I don't care what your background is, what your employment is. I just want to get as many local people, vaccinated as we can. It's just going to do us, that much better as a city.
Thank you.
Thank you.
Counselor Bova.
Thank you. I just wanted to ask Joe if, in how we're communicating with the state on this, if we can ask them if we can, work on doing similar programs to what they've done in Providence and Central Falls, where they have had really specifically targeted programs. And I know that those cities have been much harder hit than Newport, but I think, we have the potential in the summer to be hit hard as folks, think that they're getting back into the swing of things and getting back to normal. But if our workers aren't vaccinated, then we could be hit very hard.
I agree. I've mentioned that to, yes, the answer is yes.
Thank you.
Thank you. Okay, we're going to have like a 3-minute break, and then we'll come on to the school committee as posted with the state.